we are all looking for better ways to predict who's going to do well with in vitro fertilization and who's not. And the whole question really is, if you've got an older patient, how do you assess their ovarian reserve? In the old days, we used to draw blood on the third day of patient's cycle, and we would check an FSH level and an estrogen level. And using those two values, we would come up with a formula, and we would get a feel that maybe this patient would respond well, maybe this patient wouldn't respond well. And if they didn't respond well, we would start them off on higher dose medicine in order to get them to respond. And then a few years ago, a new test came along called AMH. It stands for anti-Müllerian hormone. And AMH is a really good test, we think, because it's got good predictive ability to tell us how patients are going to respond and what the likelihood is that they'll actually get pregnant. So this is another piece of data that we can put into an equation. So now we have day 3 FSH levels, day 3 estrogen levels, AMH levels, and then we'll also look at a patient's age, because that's probably the most important criteria. And we'll also do an ultrasound to look at her ovaries. We'll look at the volume of the ovary, how big the ovary is. Ovaries should measure about 30 by 20 millimeters. And then we also look at something called the antral follicle count. So early in a patient's cycle, we'll scan her, and we'll look at her ovaries, and we'll look for little bitty black circles within the ovary, and those are the very immature follicles. The more follicles that are present early in a woman's cycle, the more likely she is to respond very well to stimulation. Bottom line is that using FSH and AMH levels, we're much more able to predict who's going to respond well to stimulation, and that's going to help us also determine how to stimulate patients. So if your FSH level is low and your AMH level is high, we can start you off on lower dose stimulation and know that you're going to respond well. If, on the other hand, your FSH level is high and your AMH level is low, we know that it's going to take much more medicine to stimulate you to be able to get women to be able to make a lot of eggs for egg retrieval. If, in fact, FSH levels are really high and AMH levels are really low, those are patients we're going to have donor egg conversations with, because we know that the odds of them responding well are low, and unfortunately, even if they do respond, they probably are not going to be able to conceive.